Well, good afternoon, everybody. My name is Nick McEwan-Hall from Open Door Coaching. I'd love to welcome you to this webinar as part of our International Coach Week 2021. We're presenting this week of sessions with our partner Synergy Global, and we're really excited to have you all here. Actually, it's been a great week so far. I hope you've been tuning into some of the other sessions. If you haven't checked out the program on the website, head there and have a look. We've also got recordings from our previous sessions there as well. So welcome along. Welcome, it's nice to see you. So first of all, I'd like to acknowledge the traditional owners of the lands on which we're meeting today. I'd like to acknowledge their continuing connections to the lands, waters and communities of Australia. We'd also like to pay our respects to them and their elders, past, present and emerging. The other acknowledgement we always do when I'm talking about mental health type stuff is an acknowledgement of lived experience. And this is just to acknowledge the impact that mental health problems, mental illnesses, these sorts of things have on us, whether it's just us or people we work with, care for, love, or whether it's ourselves. So we just acknowledge that experience here. So today's session is a jam-packed one. We're going to have a look at some mental health stats and the mental health continuum, of course, as well. We're going to cover two of the most common mental health conditions here in Australia, and I'll talk about the global stats as well. We're going to have a look at what happens if we don't address mental health problems. We'll have a look at a bit of an action plan. I've got a quiz for you about some myths and misunderstandings. And then we're going to sort of round it out by considering whether or not we can still coach someone who's experiencing a mental illness or a mental health problem. Have a bit of a discussion along the way. I do like these to be pretty interactive, so feel free to send through your questions in the chat box or the Q&A box, whatever is most easy for you to use. So please do. I'd like this to be a bit of a conversation. There's also no silly questions as well, and I know there's a couple of people on the line who've done mental health first aid with me, and I'm sure they'll they'll be able to attest to that. All right, so we are going to be talking about mental health issues today. And because of that, you know, some of us might find the content confronting, or it might cause some distress, perhaps. And if that's the case for you at any point, know that that's okay and that's normal. And please reach out to me and let me know. There are ways that we can support you if that's the case. So please don't feel any hesitation in reaching out if that's what you need to do. Having said all that, there's nothing in the session that's, you know, deliberately provoking or confronting, but you never know. Everyone's different. So it's okay if that happens. And we're not going to be talking about or learning mental health first aid today, or the mental health first aid skills and actions. Rather, it's an opportunity to talk about mental health in coaching and more generally, I guess, in the work that we do in this sort of space as being coaches. So it's a broad ranging kind of session. And I'm happy for questions to come up and, you know, pose curly questions to me. I love those. Yeah, but we're not learning mental health first aid. That's a separate separate course, and I'll give you a brief overview about that later in the session as well. So I was looking at the chat box before, and I can see people are tuning in from all over the place, from all over Australia and internationally. So just a note here, the stats that I'm going to show you are predominantly Australian statistics, but what we know is that the Australian statistics are pretty typical of the stats in most countries around the world. So of course there'll be some variations and some variants, but they're very similar. They're very, very similar. So I think what we're going to see today, you can take as a good baseline. You know, wherever you're tuning in from, these numbers, these stats will be a good baseline. And we don't need to get too stuck in the statistics either in terms of supporting people when it comes to mental health and mental illness. But just know that, you know, globally speaking, humans are humans and we stack up very similarly in terms of mental health. So here in Australia and in most places around the world, 1 in 5 of us, 20% of us, experience a common mental illness every year. So we're talking mental illness here. We're not talking about, you know, the normal ups and downs that we have where we might feel anxious about something. You know, for example, if we're going for a job interview, we're feeling a bit anxious beforehand, or if we're, you know, I don't know, if we're grieving and we're a bit depressed, that kind of regular up and down in our life, we're not talking about that. We're talking about people who experience an actual mental illness, which is these things experienced on a more intense and enduring basis. So 20%, which is a fairly big number. If you think about it, 20% of us every year over our lifespan, it sits between 65 and 70% of people will experience a common mental illness in their lifetime. So it's far more likely that we will than that we won't. And certainly if we're thinking about the teams we're working with or the client bases we work with, think about what 20% of that looks like and get a bit of a sense of it. 65% of people who do experience a mental health issue or a mental illness every year don't get any professional help for it. And this is a problem for a number of reasons. Number one, because if they do seek professional support, they can experience a lot of relief. That's good for them and good for their productivity and just good for everyone, really. But I guess the difficulty here is that, and it might be a bit hidden, but it means that there must be some kind of barriers here that are stopping people from doing it. Yeah, and there are lots of barriers. Stigma is the main one. Fear and worry about what it will mean. What impact will it have? These kinds of things. So, this 65%, it's the majority of people don't get professional help for their mental illness. And this is the statistic that I'm really focused on in my work, teaching people mental health first aid, because if we can drive this number down, then down with it goes how much suffering people are experiencing. And then we can expect that, in workplace settings anyway, productivity and connection and social cohesion, that sort of stuff for those people will increase. So if we focus just on this stat, getting more people who are experiencing mental health problems connected to professionals, it's a really good place to start. Now, I want to show you this mental health continuum. And basically, we exist at any point in time somewhere along this mental health continuum. And to the far left there, we might have really poor mental health or even mental illness. And at the other end, we might have excellent mental health, positive mental health, And where we sit on this continuum changes all the time, from moment to moment, day to day, week to week, year to year. It moves up and down. Is there anyone on the line who can tell me that they've never spent time in the yellow or the orange zone of the mental health continuum? I have $1 million under my desk for you waiting, if you can prove it. I think the thing is, everyone knows what it's like to be in at least the yellow, or maybe the orange. Yeah, so it's an empathy thing, and we'll talk about empathy in a bit. But we move up and down this continuum for a heap of reasons. The things that happen to us, our biology, what social group we belong to, our gender, our life experiences. Do we have access to supports when we need them? All sorts of things drive us down and up and back again, down and up this continuum. So it's very normal to have these shifts. Yeah, very normal. Does everyone agree to that? You let me know in the chat box, or give me a little reaction or a little chat there. Does this make sense to you? Do you relate to this idea? Yeah, lots of people saying yes. Yeah, it's normal. Yeah, it's normal to go up and down. Now, in terms of yeah, Isabel says, I don't know anyone who's always on the green area. Yeah, absolutely. 100% agree. Tracy says, normal, but it differs for everyone. Yeah, exactly. It is different for everybody. Everyone goes up and down this continuum differently and for different reasons. And, this is partly why I think it can be a bit difficult to spot these signs for what they are, if they are mental illness. We'll talk about that. So if it's normal to go up and down the continuum, let's think about what the risk factors are for developing mental illnesses. And there's three categories, basically. We have biological factors, so everything to do with our biology, so our body, our brain chemistry, if we eat well, if we exercise, these sorts of things. We have psychological factors, so our coping skills, our ability to deal with our emotions, to process emotions, to relate to people, that sort of thing. And then we have social factors, which are things like our gender, where we live, are we regional, remote, in a city, our socioeconomic grouping, how much money we make, all sorts of social factors come into play. And so if we know that people are at increased risk of developing a mental illness if they have factors or risk factors that sit across these three categories. So it's quite variable. It affects everyone differently. And this is why it's a bit difficult, I think, to actually work out, should I have a conversation with someone or not? Because if it's normal to go up and down the continuum and it's normal for people to experience risk factors, how do I know when I should actually jump in and have a conversation with somebody? It can be tricky. Who here has had a thought something like, yeah, I think something's going on there. I think that my gut tells me something's not quite right, but I don't know. And so I think I'll leave it. I think I won't say anything. Has anybody had any kind of situations like this? Yeah, so Mike says, yes, I have. Isabel says, for sure. Yeah, and I think especially for us as coaches, right? Because we sit in super high rapport with people. And so as a result, we are really able to see this when it happens. We're able to notice these things. We're trained to create and sustain excellent rapport, which creates trust. And in a trusting environment, we're able to see things, or things might get disclosed to us that other people may not see. So lots of you are saying yes in the chat box. Yeah, Helen says, yes, it's a tricky call to make. I agree. So let me give you a couple of tips about how to work out when we should have the conversation and when we shouldn't. And let me preface it by saying it never hurts to ask someone how they're going from their mental health perspective. It cannot hurt them. So we can work on the basis that it's okay to ask and that we should ask. And then we're going to overlay these 3 points. So the first one is we've got to observe, or we will want to have seen, a big change in the way the person thinks, the way they're behaving, the way that they're expressing how they're feeling, this kind of thing. We see a major change in that person's normal way of thinking, feeling, or behaving. And it's their normal. It's their normal. It's their normal, I don't like this, this word normal, but everyone's got one, right? So it's a change in their normal. And again, the more we know someone, the more readily able we are to actually see this change, see this difference. Then when we think about the changes that we're seeing, we want to notice if these changes are affecting things for the person in a negative way. So are they affecting this person's ability to, stay connected socially, or, what's happening to their relationships at home or at work, or can they be productive? Can they still do things that they normally would? And the third one is about duration. So how long has this been happening? And it's a bit of a guideline, but we say 2 weeks would be the kind of rule of thumb. So if we saw something that was happening pretty mildly, like there was a change, it wasn't major, and it wasn't really affecting someone, but it was still there, we'd say, 2 weeks, we'd want to check in. If the changes are more impactful, or if the change is more major, then we wouldn't be waiting 2 weeks, we'd jump in. And what we're really looking for is, do these changes go away? Yeah. Or do they last longer than they're expected to last? Okay, so these are the 3 kind of guidelines. And this is not a prescription. It's a bit of a guide to how we might work out if we should have this conversation. Remembering what I said, that, we can't do anyone any harm by asking about their mental health. And there's lots of myths that sit around that, which we're going to come to a bit later. So these are the 3 kind of ways to think about assessing when to be concerned. Yeah. So Heather Jane says, great to stress it can never do harm. Yeah, absolutely. Sue says, agree, Heather, it can be our fear of not knowing what to say. Absolutely. I'm going to show you a couple of ways that you can have this. Yeah. Isabel says, in my experience, many develop a functional level on their day-to-day. It's only when you go deeper that they can understand how down they really are and how bad it's affecting them. Persistence pays off. Yes, absolutely. Particularly if somebody is experiencing more mild kind of signs or symptoms. As humans, we are born to survive and thrive. So we tend to put supports underneath those symptoms. And the point of that is that that might give some relief, but we might be able to get that person more relief by actually directly addressing the symptoms and not needing to support them. So again, another good reason why we want to jump in and try and connect them through to professional support. So I want to ask you a question before I put these stats up. Is it men or women in Australia who have the higher rates of mental illness, men or women? All right, we've got, keep them coming. Yeah, it's looking about 50-50 so far in the chat. Yes, Isabel says both, but men express it far less. Interesting. Not actually correct, Isabel, but yes, a common misconception. So most groups that I talk to will say, oh, men for sure. 100%, it's men who have much worse mental health in Australia, definitely. And it's actually not. It's actually women. Here are the numbers. So here's our average, 1 in 5, 20%. And women sit slightly higher than the average at 22.3. And then men, of course, would sit slightly lower. Now, I think what's interesting about this is not so much the stats and the numbers here, but that there is a misconception that is enduring that it's men who have the higher rates of mental illness than women, and this is not the case. Why? We could probably have another whole hour webinar to discuss that. But it is what it is. This is how it works. And these stats, you know, these are the most recent stats. They're a little bit old now, but they're the most recent comprehensive stats we have. And like I said at the very start, when I had a look at the research last year around the globe, these numbers sort of stacked this way. So we can see that women experience anxiety around 18%, you know, 10 for men. Depression, it's slightly higher for women than men. Substance use disorders, men more than double for women. And of course, we can see that these numbers here don't add up. And this just indicates that someone can have one or more or all of these things at the same time, a comorbidity. So just a very quick point that Isabel mentioned there about men express it far less. Zach's, I think his name is Dr. Zach Seidler from November last year, did a webinar I went to, and he'd done some research, and he said actually men and women seek help equally, but men are received differently by the people they seek help from. And that is the reason that help seeking is lower for men. However, in terms of incidents, how many people have mental health issues, these are the numbers. So, you know, there's a lot kind of at play here. There's a lot of things that are connected. But as mental health first aiders, we are very lucky in the sense that we get to keep it simple. And we just get to focus on the active participatory part of supporting people. And these numbers, these statistics are some background information that give us some confidence. So bear this in mind, you know, if you work mostly with women, for example, yeah, slightly higher risk perhaps that the people that you're working with might be experiencing these conditions. Equally, the people you work with may not be in these stats, right? You have to keep an open mind about it. So let me show you this by industry type. So have a look at your industry here and see how you stack up against the national average of 20%. So you can see here, these ones are the highest. So finance and insurance, if you're working in that space, those people who work in that space experience mental health conditions of 33% per year. So 33% of that industry, or that sort of sector, experience a common mental health issue every year. So just another way to have a bit of a look at how does the space that you work in fit with the national average? Is it close to it? Is it above it? Some interesting stats there anyway. Another way to think about it. Yeah, another way to think about it. All right, so If we start thinking now about workplaces where people have and experience mental health issues and mental illnesses, these can have a really massive impact. Really huge. So here are just a few of the things that can occur in workplaces when mental health problems are present and not being addressed as well as they could be, let's say. So decreased productivity and engagement, we have people taking more leave, so more absenteeism, we have lots of concentration issues, we might have problems interacting with other people effectively, we might have more conflict, we might have more errors, more accidents. And I'm not sure about you, but for me as a coach, when I'm engaged by an organisation, these are the sorts of things that people talk to me about usually. They say, we want to get our teams more productive. We want to get the, more engaged. We need, more productivity, or we've got a lot of conflict going on, or whatever it might be. And when I hear those things, I'm always thinking about mental health. I'm always thinking about mental health, because if these things are coming from a mental health perspective and we're not doing anything to support the mental health of the people who are displaying these patterns or these behaviours, then there's a question mark in my mind about how successful we are setting them up to be. It's a bit of a big statement, but feel free to let me know what you think in the chat box. But, it's important that we recognise the full depth and breadth of where these sorts of workplace issues can be coming from and go and address the root cause of the issue. And if we do that, then we stand a better chance of getting, the opposite of what's on the screen here: better productivity, better engagement, less absenteeism. So we want to make sure, that when we're thinking about helping someone, that we want to get in early. So if we think about someone's journey from, being well, from the green end of the continuum, to being unwell, it goes something like this. And prior to the person being unwell, they're well. So we have preventative stuff. We have good focus on well-being, all of that sort of stuff, good practices, eating well, exercising, that sort of stuff, work-life balance, etc., etc. And there comes a time where someone's becoming unwell. And we would want to hope that we can get in early with some mental health first aid kind of interventions early when the person's becoming unwell, so that they don't keep going down here, get unwell, and really bomb out down the bottom. What we want to do is make this curve go something like this, going from well to becoming unwell, and then go back up again. Yeah, go back up again. We want it to be a lot sharper curve here. I remember talking about this last year and using the phrase flatten the curve before COVID really stole that phrase from me. But that's what we want to do. We want to get in early. And the research is very clear. If we get in early, if we get someone connected to professional support early, their recovery is quicker, their treatment is more effective, and they experience relief from their suffering much quicker. The longer we leave it to go, the harder that process is for them. So again, if we're worried about jumping in and having a conversation with somebody because we're not sure if we're helping, it's quite the opposite. If we can encourage them to get professional support and there's a problem, then absolutely, we're doing the best thing we can for them. Lisa says, that's a great observation. Often we do get asked to come and fix people when actually the root cause and system hasn't been appropriately considered or analysed. Can't agree more. Can't agree more. Yeah, it's a really important thing to think about, yeah? If we were going in and consulting with an organisation about a safety problem, they said, oh, look, everyone on our factory floor is, cutting their fingers. We're having so many people with cut fingers. We'd be in there going, all right, where's the root cause of this? Is it a bit of equipment? Is it a process? Is it some training? What is it? We'd be searching for the root cause. And we need to think about mental health and safety in exactly the same way. Exactly the same way. All right, so what is mental health first aid, you might be wondering. The definition of this is simply that it's the help we give to someone who's developing a mental health problem or who's experiencing a worsening of an existing mental health problem, or someone who might be in a mental health crisis. And we give this assistance until appropriate professional treatment is received or in the case of a crisis, until that crisis resolves. So it is the mental health equivalent of physical first aid. We are a first responder. We're not learning to be paramedics. We're not learning to be counsellors. We're learning to get people connected to those services. That's what we're doing. Now, if we're thinking about physical first aid, we'd be a physical first aider. We would help as much as we can, but then we try and get that person connected to a professional if that's what's required. So same thing, just for mental health issues. And abundantly, it's about developing our literacy around mental health. What is it? How does it work? What's right? What's wrong? What's a myth? And sorting through all of that stuff, because often they're the things that are holding us back from doing the things that we need to do. Lisa says triage. Yeah, kind of. Yeah, absolutely. Spotting the signs and going, hey, is everything all right? Can I help you? Yeah. Heather Jane says duration, intensity, impact, hence the importance of mental health first aid becoming as important as usual first aid. Yeah, absolutely. I spoke to a group of mental health first aiders yesterday, actually, and this conversation came up, and I said a really simple way to work out if you're doing this right is to just have a look at your budget and see if you're spending as much money on mental health safety as you are about physical health safety. And if you're not, then maybe there's some space to do some work. All right, let's have a look at the two most common mental health problems, being depression and anxiety. Let's start off by looking at depression. So depression, as I said before, we all have periods of time where we're depressed, where things are sad, we're down, we have a low mood, and it can be for a range of reasons. It could be something terrible's happened, yeah? Could be that someone's passed away, or we've had a relationship breakup, or we've lost a job, or we've been made redundant, or whatever it might be. Yeah. So we have these normal kind of ups and downs, but depression is really quite a lot more intense than this. This is a definition from the mental health first aid kind of work. It's a feeling of deadness, an inability to enjoy things, and not being able to look forward to anything or to feel happiness. So even in those times where we're down the orange end of the continuum, we can usually have a laugh. If we're really sad about something, we might be able to have a little chuckle or a little laugh, or see the light side of things while still being sad and still being depressed. When somebody has a depression as a mental illness, it's a lot more intense than that. It lasts for a lot longer, and it often has no cause that we can point to. So depression, it's a type of mood disorder, and in medical speak, the term is major depressive disorder, and there are a range of mood disorders. Depression is one of them. A professional will not diagnose someone with depression unless they've had symptoms that last for at least a couple of weeks. And these symptoms would affect our emotions, how we think, how we behave, how we can go about doing our daily life, that sort of thing that I mentioned before. And to give you a range or an idea of the stats, about 6.2% of Australians experience depression every year. More females than males, as we talked about before. This is the sort of whole of population stat. Now, this is a really important stat. If you've got young people in your life, people under the age of 25, know that 50% of people who experience depression in their life will have had their first depressive episode before they turn 25. So if you have a young person in your life under 25 and you are concerned that they are feeling depressed or they have depression, it is crucial that we get in there and we try and encourage them to get that professional assistance early. Yeah, we want to get in early. Early intervention, super important. We also know that depression often co-occurs with anxiety and also with substance use disorders. So depression and anxiety, two different things, often co-occur. They're not the same, they are different, but many people have both. And depression can sit alongside substance use disorders as well. So let's do a little bit of activity into the chat box. We're going to do a waterfall chat, which is basically, I want you to type your answer into the chat box, but not hit enter until I say so. And then we're all going to hit enter at the same time. It's going to be a bit of a waterfall of answers. List out for me what depression symptoms are there? You know, what are the symptoms of depression? So into the chat box, I'll give you a minute or so just to write your answer about that. And don't hit enter just yet. We're going to all hit enter at the same time. Do a bit of a waterfall. So I'm just going to put a heading into the chat box so we can see that when we look back. All right. When you're ready, hit enter and let's get the waterfall going. Beautiful. Great. Can't get out of bed. Low self-care, image, spiraling, subdued, worthless, tired, sad, low mood. Yeah, great. Wonderful. Yeah, well done. Yeah, so there's a lot about sadness and sort of a flatness that's coming through. Yeah, lots of emotional stuff, sleep disturbances. Brilliant. You guys are great. You're all over this. So this on the screen is a list of some of the symptoms. They are not, this list is not exhaustive. It's not the only things that people will experience when they have depression. And nor is it saying that if someone has these things, that it's coming from depression. Yeah, so lots of these things that happen to people can come from physical health, for example, physical health problems. So these are the things that we most commonly see in somebody. And if we see a couple of these, and again, they last for a duration of time and the intensity is big and it's starting to affect them, then we're starting to think, yes, okay, maybe depression is at play here. Yeah. So, you know, it's not, like I said, it's not a exhaustive list of symptoms. And in the mental health first aid course, we go through a bit of a broader set than this, but these are the common ones. These are the common ones. And a lot of the ones that you've mentioned in the chat box are absolutely true as well. So if you've got some time, you want to have a look through the chat box, they're really good. So we talked about early intervention. The reason it's important here is, of course, like we said, if we wait, we tend to get a worse result, yeah, from our treatment, yeah, or a slower result perhaps. We know with depression that if someone has one episode of depression, they are prone to further episodes. This is not an illness that usually just occurs once and never happens again. And we want to make sure that we get in early, so we're treating that person quickly and effectively. Just to clean up my language a little bit, we're not doing any treating, we're connecting them to somebody who can. Yeah, we're not, unless we're qualified, of course, we're not providing treatment, we're providing support to that person to get that assistance. Really important. If we're in a work-based relationship with somebody, we want to make sure our boundaries are nice and clear. Unless we're qualified, our role is to get that person connected to professional support, not to be the support. So there's a lot of reasons for that, but yeah, we want to get them to professional where most of the relief is experienced. So anxiety, let's think about anxiety now. Now, anxiety is the most common mental health issue in Australia. The most common form of anxiety is post-traumatic stress disorder. And as we saw before, more women than men, a bit closer to being even between men and women, but it's the highest, most prevalent mental health condition in Australia. And, you know, like I said before, we've all had those periods where we're feeling anxious, you know, you might be feeling anxious before a job interview, or, you know, you're about to see a client for the first time, or, you know, maybe you're about to do some public speaking or something and you feel anxious. This is normal. This is the body's kind of way of going, hey, Nick, just pay attention here, mate. Like, yeah, you need to feel a bit anxious. I want you to focus here. So this anxiety can be positive if it's in the right measure. Yeah, a little bit of anxiety can help us focus, pull our attention where it needs to be. But where that is too much, or lasting for too long, or lasting longer than we think it should, or those sorts of things, or is more intense, it's not useful to us. And so we're starting to think about anxiety-based mental health issues. So again, anxiety is normal. It tends to go away once the stressful thing's finished or the stressor has passed. Yeah, but if it happens without reason, or if it happens with a higher intensity and it starts to make daily life really difficult, then we're starting to think about anxiety being at play here, or a possibility. So again, anxiety sits in a group of disorders. We all experience it. And this anxiety can go from that kind of, butterflies in the tummy, kind of mild uneasiness, right through to terrifying panic attacks and everything in between. Yeah, everything in between. But an anxiety disorder is not just your day-to-day anxiety. It's more severe, lasts longer, and starts to interfere with work and relationships. So anxiety disorder can be really, really incredibly difficult. And there's all sorts of different ones as well. There's post-traumatic stress disorder, there's social anxieties, there's phobia-based anxieties, all sorts, but very common, very prevalent, and really difficult to deal with. So let's do the waterfall again, and let's think about signs and symptoms of an anxiety or of anxiety. I'm just going to pop in here, anxiety symptoms. So type them into the chat box and then we'll hit enter and we'll do another big waterfall. All right, when you're ready, hit enter. Let's get the waterfall going. Beautiful. All right, unfocused, forgetful, panicked, constantly worrying, monkey mind at night. Yeah, I like that one. Over-dramatizing, feeling physically sick, headaches, trouble sleeping, panic attacks, focus, yeah, pounding heart, difficulty breathing. Yeah, Sue says unable to go out. Yeah, so withdrawing, lack of decision making. Yeah, not being able to switch off. Yeah, brilliant. Great. Yeah, short-tempered, quick to respond. Yeah, beautiful. So yeah, you've really got these ones down pat. I find that people are more easily able to identify depression symptoms and anxiety just a little bit, but you've done a really great job. Yeah, absolutely. Tracy says it's always in the behaviour that one can see. Yeah. Sometimes, most of the time, we can spot the signs. Sometimes we won't, but yeah, we learn that we can. If we really look for them and see, and we look for what we're looking for, then yeah, we can see these signs. So again, some physical signs. So the pounding heart, chest pain, rapid shortness of breath, dizziness, headache, sweating, tingling. Does it sound like another physical issue that people might experience? Pounding heart, crushing chest pain, rapid heartbeat. It sounds like a heart attack. So a anxiety, or angina, yes, a panic attack or extreme anxiety can appear very similarly in symptom terms anyway as a heart attack or something more sinister. So we always, this is another reason why we don't entertain diagnosis. That's not our job. Our job is to spot the signs and get help for that person as fast as we can. So from a psychological point of view or the thinking point of view, anxiety does sit in the thinking quite a lot. So you've mentioned most of these things, concentration, racing mind, or equally the mind can go completely blank. Yeah, it doesn't always race, it can just go empty. Might have anger, confusion, might have vivid dreams. And behavioural is an interesting one for anxiety because a lot of anxieties can be provoked by situations. And so the behaviour that people exhibit is to try and moderate that feeling of the symptoms. So for example, if they have a social anxiety, they won't go to social events, that kind of thing. Yeah, phobic behaviours, if they're scared of, I don't know, if they're scared of magpies, maybe they don't walk their dog through, through a park or something like this. So there's quite a few. And you got most of these in the chat. So in terms of early intervention for anxiety, there's some interesting impacts here that anxiety does have. We see a link with depression and alcohol and other drug use, as we said before. There's a strong link between anxiety and suicide attempt. So suicidal thoughts and suicidal attempts don't just come from depression. We see a lower educational achievement amongst people who experience anxiety. And there's some research out that shows the link between anxiety and early motherhood. So there's a whole range of reasons why we want to try and get that person supported by a professional to ease the suffering down a bit as quickly as we possibly can. And I want to just show you some of these things to get you thinking about why should we have these conversations and why it's so important, but also hopefully so that if you're sitting there on that kind of on that sort of seesaw of do I have the conversation, don't I, do I, don't I, do I, don't I, that hopefully you land on the yeah, I'm going to, because if there is something going on, I can have a big positive impact, which is pretty cool. That's pretty cool. So, and I realize that that's difficult sometimes. So let's now think about how all this affects us in our work as coaches. Now it's Coach Week and we're thinking about coaching this week. Let's connect the dots of mental health and coaching. So, as we said before, statistically, you're probably already interacting with somebody in your work or in your coaching or a family member who's either experiencing a mental health problem right now, or who has had an experience in the last 12 months, or who has at some point in their life, or who will. And so, like I said before, 70-something% of us in our lifetime experience a mental health problem. So from a statistical point of view, it's quite unlikely that you're not already working with someone in this space. And you may well know already that you are, but you also might think, actually, I don't think anyone in my coaching client list or my organisation is. Statistically, that's not going to be the case. So here's some ideas. If you've got 10 clients, it's 2 of them, 20 clients, it's 4 of them. If your workplace has 50 people, it's 10 of them. It's everybody. This 1 in 5 affects everyone, 16 to 84 years old. So it's quite unlikely that you're not working with them already. So it's a good reason to have a think about getting the mental health first aid skills under your belt and really understanding this stuff so that when you're working with someone, you can spot the signs and encourage them forward to support. It's really quite cool when you can. All right, I'm going to pop a little poll quiz up here for you. A couple of questions in here. We'll work through the answers. Don't worry if you get them wrong. That's okay. We're going to work through them. We're just working through some myths and misunderstandings here. So have a go at that. I'll give you a minute or so to do that, and then we'll go through the answers. Once you've answered them all, there's a little submit button at the bottom, I think, which you need to hit as well. All right, I'll give you another 30 seconds or so. All right, about half of you have got your answers in. Give you another 20 seconds and then we'll share the results. We'll have a look. All right, I'll give you another 10 seconds and then we'll share the results here. All right, I'll just close that down. I'll share the results. Okay, so let's work through these questions. So number 1, if I ask someone about their mental health, I might make it worse. Well done, congratulations, you all got this right. So we can't affect someone's mental health or their mental illness by asking about it. We might make them feel a bit nervous or a bit anxious by having the conversation, but we're not going to create or worsen a mental health issue in that person, mental illness kind of framework, I guess, rather than just, temporarily feeling a bit anxious about it. Number 2, avoiding something anxiety making is an effective strategy. So it's a bit of a trick question. It is effective in the sense that if you avoid something that makes you anxious, you won't be anxious. But in fact, in the longer term, it's not an effective strategy because oftentimes the things that we're anxious about, we can't control. So if I'm anxious about birds, for example, and I avoid birds, and that works for me. I don't feel anxious because I'm avoiding the birds, and suddenly I'm out somewhere and I have a bird, you know, come towards me, or I come across a bird, my anxiety response is likely to be higher. So it's not an effective strategy, actually. And again, this is something that would be addressed with a professional. All right, number 3, 50-50, interesting. So it's best to debrief after a trauma immediately after the event. So this one is false. And the thinking here is that we want to debrief after traumatic events, of course, but we want to do it when the person is ready and able to, because if they are not ready and able to, or even if they are, you know, going through the details of a traumatic event can be as traumatic, sometimes more so than the actual event. So we don't want to rush this. We want it to happen, but it needs to happen when the person's ready. Number 4, so people with mental illnesses are more violent than the general population. This is false. In fact, people with mental illnesses are far more likely to be the recipient of an injury than to inflict one. So this is false. Number 5, someone with a mental health problem is unable to think straight. So again, maybe a bit of a trick question, perhaps. Yeah, mental illnesses are usually and very often episodic. So during an episode of poor mental health, sure, maybe someone can't think as clearly as they might be able to when they're well, but when they're well, they absolutely can. So, you know, if someone discloses to you that they have depression or they have anxiety, this is not a, it's not a, you know, oh, this person is now depressed 24 hours a day. Yeah, it's very much about where are you on that continuum today and how's that working for you. But there is a myth out there that people believe that if someone has a mental health problem, they just can't think clearly, period. And it's not the case. Well done. That was great. Well done. Super impressed with all of your skills. It's great. All right. So the big question. With everything that you've learned, can you coach someone who has a mental health problem? In the chat box, yes or no? Can you coach someone who has a mental health problem? All right, most people saying yes, yes, yes. Yeah, Lisa says yes, it's coaching, not counselling. Isabel says it depends how chronic, severe, must be functional, it depends on the severity. Yeah. So my answer is yes, right? Yes, as long as that's the best thing for the person at the time on the day. Yeah. So yeah, and look, a lot of you in the chat box are saying it depends, you know, on how severe. They have to be functional. We have to stay away from counselling. I agree with all of that. Yeah, absolutely. So, you know, like we said before, it's highly likely you're coaching people who are on medication or who's receiving support already. You know, it's not unusual in our experience for people to say to us in coaching, you know, I see a psychologist or I see a counsellor and I talk about stuff with them, you know, that kind of thing. Yeah. Isabel says many coachees don't want to pursue the counselling option. It's a fine line. Absolutely. Where there's no crisis, the person has, you know, every right to choose what they do and what they don't do. So, you know, I think you'll find that if you can absolutely coach somebody with a mental health problem, because again, they're not going to experience that mental health problem, that mental illness 24 hours a day, right? So if someone discloses that they have a mental health problem, you might like to ask some of our beautiful coaching questions, things like, you know, okay, and how does that, you know, how might that work with our coaching? You know, what do you need from me as a coach to support you with that? You know, you might want to draw some clear boundaries to say, look, thank you for telling me that, you know, I am going to focus on the coaching side of things. Or you might like to say, look, if I think that actually a different approach like counselling or psychology is better for you, I'll let you know. You know, so I think we can put the boundaries around it, but we can absolutely still progress on if we are clear about those boundaries and we stay within them. Yeah. And as Heather Jane says in the chat, as long as we stay clear about our scope of professional practice, agreed. So some people will have coaching and counselling qualifications, for example, and they might do a combination if that's what the client wants. If that's what the client comes to us for, then sure, but you want to be really clear about what your purpose is for your client at the time. Yeah, Mike makes a great point. If we think about the stats, then we're probably coaching someone with a mental illness anyway, or a mental health issue without even knowing about it. Absolutely. Absolutely. I can almost guarantee that. Yeah, I can almost guarantee it. So I think that the answer here is yes, with an asterisk at the end that says, as long as it's the best thing for the client. Yeah, and as long as we stick to being coaches. Yeah, 100%. That sometimes is a controversial opinion. So if you don't agree with me, please pop that in the chat box. I'm happy to do that. Happy to do that. We had a lot of conversation last year. I remember about, people saying, "Oh, I'd ask them if they've had." I'd ask them on an intake form if they have anxiety or depression or anything like that, or if they're on medications and things. That's what they would do. And my question at the time, which I think is still the question I would ask, or when someone says that, is like, well, do you do that for physical health problems? Because a physical health problem could affect our coaching, couldn't it? So if you're asking about mental health stuff, I would just want to be clear about why. Yeah, just really want to know, why do I want to know that? What positive difference is that going to make for my client? And if there is one, super. Lisa says, my concern is around the lack of awareness from both coach and coachee. Yeah, I'm guessing you're meaning in terms of, where the boundary is, that kind of thing, what the work is, I guess. Lisa says it often comes up in coaching conversations. Yeah, I agree with that too. Yeah. So good discussion. I really love this discussion. Isabel says, I only bring mental health issues up front if it is very evident in the beginning. Otherwise, rapport and trust needs to be established before they're comfortable sharing. Yeah. Great. Yep, I really like that. Lisa says awareness of mental health issues. Yes, absolutely. So if as a coach we're aware of them and we know signs and symptoms, we're able to spot them. And same thing with our clients, right? If our clients have that awareness and they know about signs and symptoms and they can say, actually, I think I do have an anxiety problem, or I've been to a professional and I know, then yeah, that's different, isn't it? Definitely different. Yes, Mike says, especially when you're talking about conflict resolution issues, yes, mental health stuff can come up. Yeah, great. Yeah, it's a interesting area of our work, that's for sure. That's for sure. So let me, oh yes, thank you, Isabel. We have to be super wary not to label our clients, especially not being qualified to do so. Oh, I can't agree with that more. Even as a mental health first aider and a qualified counsellor, I'm not doing that. I'm curious about it, but I'm not deciding it. Yeah, I'm letting my client tell me, and I'm following it with them. Beautiful. Love it. All right, so mental health first aid. If you haven't seen this course, it's an amazing course. It's just awesome. I've trained for Open Door last year, close to now about 700 people in mental health first aid. And lots of them are coaches and leaders and managers. And I just think that this skill set is such a good fit for our coaching skill set, such a good toolkit to have. And I know there's people on the line who've done the course, so feel free to let us know in the chat box what you think. But I think, as I said before, the reason for this is that we have such good high rapport, trust-based relationships with our clients that we're well positioned to spot it. And I think we're also well positioned to then open a beautiful, respectful, caring, empathy-driven conversation with the person that ultimately leads to them receiving support. It helps us to be comfortable and confident and prepared to have the conversation, which is what a lot of us talked about before, is why we don't have these conversations. Well, I'm not sure what I should say. I don't know what works. I'm not confident, I don't have a model, that kind of stuff. And mental health first aid gives you all of these things, It's really, really important. And, when we have these skills, we can break down stigma, we can change lives, and we can save lives. And on a personal note, I know that the mental health first aid that I have provided to people has done both of those things. change lives and save lives. I know for sure because they've told me. And if I did not have these skills, then I'm not sure I could have had that big an impact. And let me tell you, it's amazingly rewarding as a coach and as a friend and as a colleague to be the one who opens this conversation that can be a bit tricky, but gets that kind of outcome. It'll change their life, and I promise you it will change yours as well. Lisa says, I get really frustrated with people around the office who say things like, oh, they're bipolar, making flippant comments about mental health and behaviour. Absolutely. If that's happening in a workplace, it should be stamped out. You wouldn't have someone walking around going, oh, that person's got one leg, you know, or that person's got asthma, or that person's, you know, got whatever. It wouldn't fly. So this stuff shouldn't fly in workplaces either. Heather Jane says, especially with empathic compassion, yes, using our direct communication skills, ICF competencies, yeah, absolutely. Mike Cameron says, a great program for coaches as well as many of our clients' businesses. I frequently recommend the ODG. Oh, Open Door Coaching Program. Oh, thank you, Michael. That's lovely. Heather Jane says, I'm a registered nurse who has run a mental health unit and I still found the program helpful. Yeah, it'll give you confidence. Yeah, it is an excellent program. Check it out. It's on our website at opendoorcoaching.com.au. It's all delivered virtually as well, so nice and flexible. And importantly, if you have an ICF credential, it will earn you 24 CCE points, which is pretty amazing. So I'd love to open this up now to questions, thoughts, light bulbs that have gone on, things that have kind of been pinging through your mind as we've been talking today, and open it up to a bit of a conversation about some of those things, because we've covered a lot of ground. So, you know, I'd love to hear what you're thinking in that space. Lisa says, do you also do the redo sessions? Yeah, the refresher sessions. Yeah, we do. We have done refreshers in the past. So, yep, absolutely, we can help you with that. Particularly if you've got an organisation, you know, or a team that needs to be refreshed, we can certainly do that training for you. Yeah. Heather Jane, no, we're not going to talk about algae today. So if you're a ICF credential coach, I've just dropped into the chat box the CCEU certificate from today's session. So you can download that from the chat box so you can claim your session, your hours for this session. It's been great having you here. Thank you for taking part in the waterfall. I love that waterfall activity. Yeah, it's really great. If you have a look in the chat box and scroll up a little bit, I have just dropped the certificate in there for you. So you can download that certificate from there. Thank you so much for coming along. Thanks for taking part in our International Coach Week conference. It's been great working with you. There are my details on there. If you'd like to have a chat about anything you've seen today or about mental health first aid, I love to talk about it. So feel free to give me a call or drop me an email. Thank you so much. Yeah, feel free to do a screenshot. That's fine. Thank you so much for coming along. I'll wrap up the recording here. Have a great rest of your International Coach Week 2021. We hopefully will see you on a session later in the week and perhaps on a mental health first aid course sometime soon. Thanks, everybody. Take care. Bye for now.